Inviting me for this webinar, which is of utmost significance, if I could say.
Thank you, sir.
Now, I would talk on a very different note. I would talk positive today. All of know we have been stuffed with the media up to date that what is COVID has done in terms of disaster globally, what it is likely to do. There are speculations, blogs, opinions, and things like that. But I look at that it is you who can turn it to your advantage. There is a big opportunity, and I'll try to document. I'm not belittling the plight of the migrant workers or the people who are daily wages. 26% of the workforce and about 60% of the workforce in India is very difficult. They can't change their profession. Their intellect doesn't permit them to do. But let us talk positive and see what one can do in a given circumstances. Now, let us rehash the scenario to tell you this is a pandemic. Pandemic, the word has seen, may not be in our lifetime, but we have seen. But this is an unprecedented pandemic with 213 countries involved as of few hours, and 60 million cases have been diagnosed as COVID. We are not talking about the number of cases or the testing incapabilities of the country, and close to 3.6 million people are dead and many are going to die. If you look Indian scenario, you will see that, 1 minute. You will see that India is right here. Now, don't think that we are merged in between the countries. India has some advantages and some disadvantages. India has not gone, the virus is kinder to India, maybe our immunity or something. Our mortality figures have not gone like US is topping, or China was there, or Italy was there. We are going the trends of Singapore, Hong Kong, South Korea. But India has a disadvantage of high density of population, and it's very difficult to follow a social distancing. And that's why I think the government of India has done a commendable job of restricting. Nobody can believe that you can have billions of people for almost more than 60 days now. This is the Indian scenario. 166,000 people have been diagnosed and 4,706. So there is more. It's not really, when you look at comparing the rest of the world, it's not a bad scenario, but it is a bad scenario because what is the sense of anticipation is terrible. Now, there is a plight in this, that it is, this is an inversely proportional graph. If you look at globally, countries like Singapore have gone more than 90%. Colombia has done up to July 1. But the more you do the quarantine, less would be the economic backlash. So obviously the politicians and the governments are in ethics that it's a trade-off. It's a sensitivity analysis that whether we bite the bullet and reduce the period of lockout, and let us do. So now this is a global crisis. There's no point in its origin or something. This is a global crisis today. The world is in such a pathetic situation. The countries who used to come to rescue for floods and other disasters, how can one anemic give transfusion to the other anemic? So there is no practically, everybody is fighting their own battles, and so would India will have to fight its battle. Let me make a comment. At the Indian government level also, I think government of India or any country's government, including the United States, have a spectrum of population to look after, and hence their policies cannot suit everybody. So my interpretation is that each one of us will have to look after our safety and do not look for the government at all times come. So what are the commonalities in this? Entire world is in the same boat. It is not one time or time bound effect. And there is a common societal fragility. The entire world in same boat means even the billionaires are having more anxiety and trying to manage businesses are at stake. In fact, the villagers, I have got some feedback, are at the best because they know very little about what is happening. They know only about the police's restrictions. Otherwise, the entire society is at risk. Now, what is the fragility? This is anxiety, fear, and uncertainty. There would be people who would say that they don't have any of these things, they are in a denial mode. Let us see what is the current status, because every assumption on prediction depends upon whether when we will have effective treatment for COVID, markets would bounce back if we have a drug or vaccine, or anything would be dependent on that. Let me give you a factual position. One thing I would like to say, the only remdesivir is a drug by Gilead, and what I was happy to find out that it has been named after an Indian who has designed, Ramesh has designed the drug. It's a matter of proud for all of us, which is a frontline drug. But other drugs are, because as anybody knows, drug development is a very difficult process. It takes a lot of time. And hence, all they are trying is trying other antiviral drugs, other immunosuppressants, including BCG. So I don't see any hope of drug in the near future. Vaccine, everybody is talking about vaccine. There are total 100 projects, 8 candidate vaccines are being tried. Moderna is in frontline. University of Oxford and AstraZeneca have tied up, and they have already gone ahead with 500 participants, 30 million doses they promise. They hope that they'll be able to give. And similarly, other companies are trying to do that. How about India? I think India can play a leadership role here because of our tremendous experience of producing vaccines. And Serum Institute of India, which is some of we should feel proud of, 53 years old organization, they produce 1.5 billion doses every year. And now they have collaborated with the Frontline Group at Oxford and hopeful of producing 1 million doses. But mind you, when the dose would reach to you according to priority is anybody's guess, because we need totally 4 to 500 billion doses. So it's not enough to think out of box. You have to think that there is no box. And please pardon my pessimism, but because in order to prepare you for your inner strength, I have to say it should be 2 to 3 years before. Don't go by these arbitrary deadlines of lockout and all. This lockout and lock in, unfortunately, we'll have to live with the virus for that period of time. Now, whole world is, wherever I talk, is thinking what we were. When will we be able to restore our business? I would like to change the dimension of thinking. What we could be. And that means one simple thing: reinvent yourself. There is no other option for us than to reinvent ourselves. Forget about restoring what you were, whether it's your business or you are a doctor or a hospital. You have to think new ways. Take it as a challenge and reinvent yourself. Think of the things which you were not able to change because of the environment, like telemedicine. But now it is an opportunity for us to change. There is another very good thing of the lockout. I looked at the neuroscience behavioral, it works. Any habit which you make for 3 to 6 months, brain cells communicate and that becomes firmed up in your thing. And that's why I hope that during lockout, we have developed some good habits. Maybe it's exercise, maybe it's respect for each other in the family, maybe it is communion of staying together. I think, or not traveling unnecessarily. Take my example, I would be away practically every second one, but I don't feel that there was a need. And look at the corporate sector. There are millions and millions of square feet of space for offices are now redundant. 80% of work they are able to do well, and I'm sure with technology they'll be able to do well. So it's a time to think about. So there are some predictions. I think because people who were not having access to healthcare, the number has gone up. Uh, I think we expect that there would be a universal health coverage. Where would the money come from? How it would happen? But people will have to be compensated because they have suffered a lot. Frontline workers, world over, have got cheers, a soft corner, because they have rescued us by taking risks in. So I expect that there would be wage pressure and governments will have to relook into compensation for frontline workers. Virtual healthcare is already taken off. In US, it was 1% people. Now it is 81% of people are telemedicine because that is going to be the way. You don't have to show up to the doctor for more than 60% of times. You can do might as well on a good telemedicine station. Lifestyle changes, people are thinking, and that's why the webinars are so popular, that people are giving it a consideration that preventative medicine can never defeat high quality of, now can always defeat any quality of tertiary care medicine. And technological, I call it a third technological revolution. I heard one of the illustrious alumni, Dr. Tobacco Wala, and he said that this is the third revolution, which is cloud, 5G, and data and AI. Previous ones were internet, and then before that were telephonic cell phones. So I think with these thoughts, I will hand over back to Shakshi, and after Dr. Parikh says his presentation, we will have the pleasure of questions from you. Thank you very much.
Thank you, sir. Thank you so much for the wonderful insights. We'll have the questions after Dr. Rajiv sir's presentation. So we request all attendees to type all the questions in the chat box, in the question and answer box. So we welcome Dr. Rajiv sir to address the gathering.
Thank you, Ayushi, and thank you, Dr. Bhandari sir. It's indeed a great pleasure to be able to share this webinar space with you. I think what you have actually focused on today is to try and take the misery out of the agony that everybody is going through. We do not know where we are today. We do not know where we are heading. We do not know what is going to be the future, and we do not know how is it that we are going to fit into the future. And I think your concept, as we discussed, that we should try and turn this crisis into an opportunity. It's an opportunity to try and move forward and to try to live the way we wanted to, but we couldn't because of everything else that was around us and certain things which we all took for granted. I mean, we were told that that is the way this should be done. But today, that entire thing has to be reinvented. The word is going to be reinvention. We have to reinvent ourselves. We have to reinvent our relationships with people. We have to reinvent our work culture and etiquette. We have to reinvent the way we travel. I mean, as well as Dr. Bhandari very rightly said, there was so much of corporate travel and so much of useless travel. I know of certain, some corporate friends of ours. They used to be in Delhi. They would take the flight to Mumbai and come back the same evening just to go and meet someone. And today, I'm sure all of that and a lot more could be achieved by staying in your office space or at home for that matter, and getting all that done through either a webinar or a chat, maybe including more people. So it's basically we have to try to reinvent whatever we have to do. So I'm sure all of us, most of us had certain ideas that I have dreamt of, that, that's the way I wish this was the way this could have been done. This is the time. The time is now. We have to create a new normal, because the old normal is over. There is no normal what was. Today is what is going to be the new normal. And I think that new normal has to be reinvented by us ourselves. And as Dr. Bhandari very beautifully brought out, that universal healthcare is something that one will have to look at. There has to be some sort of cover which every government, every institution, every corporate house, every employer will have to look at, because unless there is universal healthcare, it's going to be extremely difficult for people to look after themselves, especially in third world and developing countries like India. I think there will have to be a concept of universal healthcare, and that has to come up. And I think the government is looking at it, and I think they have to probably give it a lot more attention and try and bring this up to steam, so that more and more people are covered with this universal healthcare. As far as doctors, I mean, we are doctors, and I can tell you, I'm at the Medanta Medicity Hospital in Gurgaon in Delhi, and our practice has changed in the last 2 months that we have been. We are not working from home because we are not directly frontline workers, but we do have a lot of emergencies coming through the hospital, and we are taking care of those. We are in the hospital every day. We are looking after the patients that come through. But the actual number of patients coming for routine consultations, for problems which were not really of any emergent or emergency nature, those patients would just come and sit outside our clinics, and they would just wait endlessly to be seen by a doctor. Today, I think what has actually happened is that we have switched majorly at the Medanta Medicity Hospital to a system of telemedicine, which Dr. Bhandari was alluding to. So telemedicine is something you can contact your own doctor, and most of the big hospitals, most of the corporate hospitals, most of the organized hospitals already have some sort of platform which can be contacted, and you can actually chat up with the doctor. The doctor can be given all your information prior to him consulting you. Let me get you into a little secret. Most of us are seeing 150 patients per day. And believe me, it's extremely difficult for us to remember each and every patient and each and every prescription that we write. So it's always better that we have a look at the prescription or some reminder which tells us about the patient that we're going to be talking to. And that is where telemedicine comes in. This platform that we have at the Medanta, which we share, is something in which before we connect with you on a video or a telephone platform, we are actually having privy knowledge of whatever has been done with you, your previous prescriptions, your previous investigations. So we have complete information about you before we even see you. So this has actually helped our consultations, because we don't have to be repetitive and keep asking the same questions again and again to be able to know what is actually wrong with you and why you are there. All that information is there with us. We are sharing that. We already know that, and we can spend more time, we can give you more quality time during our consults. So it's extremely important that for non-emergency situations, for routine and consultations, I think we have to change the way we practice, and the way forward is telemedicine. And I agree that lifestyle changes are extremely, extremely important. Lifestyle changes are something that the lockdown has taught us. The lockdown in India, actually, if you really look at it, I think the lockdown, apart from maybe reducing the onslaught or postponing the onslaught of the disease, the numbers are going to be there. Those numbers would have happened in March. Now they're going to happen in June, May, June, or July. But what it has actually done and helped us to do is to help the administration and the hospitals and the government to spruce up and build up the supplies, the supply chains, the infrastructure, the hospital infrastructure, get everybody act together and start actually moving on. So now today, the hospitals are a lot more prepared than they would have been had all this happened on the 1st of March or the second week of March when the first lockdown was announced. So this lockdown has actually helped us now. What has it done? The lifestyle change that has occurred during the lockdown. People now are spending more time at home. They're eating lot of fresh and lot of home cooked food. There is all that unnecessary food that you used to be eating, which was either probably not cooked or maybe not cooked well enough, or maybe not cooked with all the fresh ingredients. All that has changed. So a lot of people are a lot more healthier. You feel more comfortable with yourselves. And of course, it has given us time to introspect as well as have an improvement in our interpersonal relationships. So lifestyle changes have actually helped, have actually the lockdown has actually given us a chance to improve on our lifestyle changes. So I think with this I'd like to summarize whatever Dr. Bhandari has said, that let's not look at this COVID as a crisis. Let us turn it into an opportunity. Let us reinvent ourselves. Let us look at preventive medicine, and let us look at telemedicine to consult, and let us reduce wasteful expenditure. That will be good for us. It will be good for the society. It will be good for the country. It will be good for the environment. It will be good for the planet. So everything would be in order if we look ourselves. And the mantra today for this webinar meeting is reinvent yourself, find yourself, and try and do things which you wanted to do, dreamt to do, but couldn't do, and can do now if you put down your thoughts and get on with it. So thank you very much. Now I think we go back to Ayushi, and if there are any questions, obviously we'd like to take those on. Thank you.
Okay, thank you so much, sir. And I would like completely agree with the points both of you have mentioned, that this is the time to adapt, and the lifestyle changes will definitely have to be prevalent in each and every individual's life. And preventive healthcare also, as you mentioned, it has to be inculcated.
Ayushi, could we have your video on?
So I'll just try doing that. Give me a moment,
Okay.
sir.
No, go ahead.
So I think there's some issue with my camera. I'm just
No problem. No problem. Go ahead. Go ahead.
okay. Yes. So as you mentioned about the preventive healthcare as well, I think that is the mantra that is actually has to be adopted right now. But sir, since you mentioned, Dr. Rajiv, sir, you mentioned something about food, that now people are switching to more healthier options, and they've stopped eating the junk or the different kinds of food that they were eating earlier. So then, can you suggest some kind of foods as asked in the question box as well, that how to work on immunity? Like, is there any special plan that we can use right now in for building up and boosting our immunity?
Well, yes, you see, there are certain immune boosting foods, as they say, and Ayurveda and our Indian lifestyle is full of it. If you go back, I think each and every family has, as we say, our grandmothers and our nannies and our dadis, they all had a little sort of, a store box of all the things that would help to boost up our immunity, and that was something that was always there. But of course, today in the present era, there are certain vitamins which have been touted as immune boosting, such as vitamin C, vitamin D3, vitamin B12, and zinc. These are 3 or 4 important vitamins and minerals which can actually help boost our immunity to an extent. Boosting the immunity doesn't mean that you found a cure for COVID. So don't go away thinking that if you have these things, you're going to be able to fight COVID. It's not anti-COVID. It is basically improving your own circulation, your own fighting ability to be able to fight the infection. Any infection for that matter. It's not just COVID. It could be the common cold, the flu, the typhoid, or whatever else that could happen. So immune boosting, there are foods, and then I think the most important thing which actually boosts immunity, which we should be doing, is exercise, regular exercise. I think that is extremely important, because they say that if you are sitting all day, that is the worst thing that you can do for your immunity. You have to be active, you have to get out, get up and about, and do whatever exercise that you can. And cardio exercise and static exercises, yoga, pranayam, all these things, they actually help, because those are the things which can actually help. And of course, again, lifestyle changes, things like, reduction, or maybe even giving up alcohol for that matter. Then stopping smoking. The smoking is actually, sitting down and not exercising is the new smoking. So when we say stop smoking, I say stop sitting down and keep moving, so that you don't have the detrimental effects of sitting down and putting on weight and reducing your immune systems. So that is what I would like to say. Maybe Dr. Bhandari would like to add to this.
Now, sir, you covered a wide list. I would add something which very few people believe. I am a great believer in psychological immunity. And psychological immunity comes from your positive thinking. Don't be overloaded like cricket commentary that, oh, afternoon that many patients have died and evening that many patients have. This gives me an impression those who do this are probably thinking where their number in the line lies. So get out of that, and there is a data to show that this lifestyle changes and psychological immunity, that and then don't look for this is a very complex situation. There is no one magic pill to protect you from this. Try and understand that if you are an asymptomatic carrier, which we assume the India has more asymptomatic carriers, then you are likely to infect at least 4 people. We don't have Indian data, but if you go by global data, 4 people are at risk because of you. And imagine it multiplies from 4 to 16 and multiple of that. So it is for your interest to follow. And somebody has asked a question in question box, I'll cover it up, that will 14 days be a magic pill? No, even after follow the countries like China, they've used technology heavily, that this will be a new norm. You'll have to follow social distancing after, and I have no misgivings, at least 18 months to 3 years. Until that time, you have the responsibility of protecting yourself. And Rajiv said, I would re-emphasize on the tinned food, preserved food, all of them are full of toxins. Environment is full. We can't do much about the environment in India, but yes, COVID has done enormous good to the environment. So rethink about when you pull out your car from a garage to go to Connaught Place for an ice cream, can you do without it? Is it necessary? And then think of it, when you could do without it for 3 months, what is that you can't do it? It saves the so many things. So it's a time to really introspect and think about what you should do. And I would say again and again that it is not government which will be able to do it. Is individual level will have to really think that how do you protect yourself, your family, and how do you help country and managers to do that, rather than arguing that this is unnecessary or this is political or something. It doesn't make any sense to me.
Quite rightly said, sir. We have one question from Pooja Rai, that do we need to change our psyche for the lifestyle changes?
I don't have any doubt about lifestyle changes. Rajiv talked very, very aptly about the exercise. Exercise is not in buying a Nike sneaker and running to the gym and joining a gym. It is in your mind. Until you sell it to your mind, everything is your psyche. So I think psyche is the most important thing you have to work on. How much you are spiritually grown, everything will happen, because I do believe everybody doesn't get it. Whether I'll get it or not, time will show. But I'm very confident that I would be the last person to get it. And that kind of attitude you have to develop. It's not based on hollow thinking. It is based on what you do. And you are doing everything possible what to do. And then go to Gita, what happens is nothing in under your control. Do everything possible what you can do. Let people call you chicken, but accept it and do everything possible, even if it is unnecessary.
I would reinforce that. I think absolutely. And I think, as we say, we are going on repeating the same word. We have to reinvent ourselves in every sphere in life. When we are talking about lifestyle changes, we are talking about mindset. The mindset has to be reinvented. You have to believe that you have to change. And unless you want to change, it is not going to happen. So you have to change your mindset, and only then will you start doing what Dr. Bhandari said about, just a simple thing like getting into the car and going to the city center to have an ice cream. Do you really need to do it? Is it not available within walking distance of where you live? You could just walk to the place and get it. I'm not saying don't go and have an ice cream. By all means do. But then walk to the parlor, which is close to your place, rather than drive all the way to India Gate and then spend fuel and burn carbon yeah, carbon fossil fuel and add to the pollution. So I think those things have to be thought of. And I think, as they say, the mindset has to be changed, and exercise is mostly a mindset game. Unless you think about it, you will not do it.
Right, sir. But sir, like I also have this personal question, and I think Vidisa also has this question, that how do you keep oneself motivated during this pandemic situation? I mean, there's so much information available. Everybody knows that, you need to do these things, but how to just stay motivated and, achieve those goals that you're setting for yourself?
Rajiv, you want to address this question or
Yeah,
do you want me to?
I could see. The first thing that I would say is that there is so much information available, and as Dr. Bhandari also said, there is what is called, we are in the middle of a pandemic. There is another epidemic that is going on, and that is infodemic. There is a complete, there is a burst of information, blast of information that is happening everywhere. It's an infodemic. So you have to find, you have to use intelligent thinking, and you have to sift out what you think is good for you and for the family and for yourself and for your future. So don't take everything that comes in front of you. Learn to sift, learn to sort of separate the grain from the fiber, and try and keep the pertinent information to yourself. As far as just looking at the information that is available, and the motivation would come from what you think that you want to achieve. You see, what is it that motivates you? Either it's money, or it is power, or it is control, or it is a sense of self achievement and a feeling of well being yourself. Your motivation should be that you should feel well within yourself. You shouldn't need any material things to keep you happy. You should be able to be happy with yourself, and that should be your motivation. Stay happy, keep happy with you, yourself, and your near and dear ones and your family. So the motivation should come from within, and it is, again, it's a mindset thing. You have to actually believe that you have to do these things, and that is enough to keep you motivated.
One word I'll add about information.
Yes, sir.
Information was started when it was started historically to give right information to the people. But now, mind you, it is one of the biggest business. Until they create a news every day, a lot of people would be out of business. So there is a news out of no news. Similarly, what internet has done or Google has done, that you have to be the biggest filter. Like Rajiv said, that let there be a heap of information fired at you, but you will filter and take something what is positive. As regards to the motivation part of it, let me tell you two things will help you in this crisis. One is, really it will help you. Number one is communication. Don't be to yourself. Vent out your thing. Don't let your pain bodies build. talk to somebody, pick up a phone, talk to a neighbor, talk proactively to somebody, auntie, can I do something for you? And another is other centricity, because you see the number of youngsters have come in here to help old people in the US is unprecedented. They go and bring supplies for them, they bring medicine, they look after them, even when the old people are vulnerable. India has a tremendous power of young people. Our one of the savior is the average age is 25. So take positive advantage of population and think innovative ways how you could be innovative, which will give you a sense of satisfaction, sense of fulfillment. You don't have to have a certificate or award, but it would be your satisfaction. And once it is rewarded, then you will get automated to do more and more, and at least you are very motivated to do such things.
Right, sir. Thank you. So there's a question that in this current situation, doctors are only focusing on COVID-19 patients, and people with several other problems are not getting the treatment. As Dr. Rajiv also said, that there was an overflow of patients, and like, earlier how the situation was, and now it's totally different. So how to deal with this new problem with different patients having different ailments?
See, it's not that the normal patients, the routine patients, the non-COVID patients are being neglected. It's not as if they are coming to the hospitals or they're going to the doctors and the doctors are asking them to go away. That's not happening. What is actually happening, there is a fear psychosis which is developed. Everybody thinks that if he gets out, he's going to contract the COVID infection and he's going to die. So, I mean, there is that real fear which is actually keeping a lot of people at home and not wanting to come out, venture out to get or secure any treatment. So I can assure you that the hospitals which are the non-COVID designated hospitals, they are open. There are, I mean, I can speak for Delhi. There are multiple hospitals which are open for non-COVID ailments and non-COVID patients. Medanta Medicity Hospital for us, for us at this point of time is a non-COVID hospital. We do not have any planned COVID admissions because what we've done is that 3 major private hospitals have taken it upon ourselves, and we have taken over another private hospital, which is the COVID hospital, supported by the staff of the 3 doctors, nurses, and paramedics of the 3 hospitals together have formed one hospital, which is functioning as a COVID hospital. So this way, we are able to control and contain the COVID infections in one hospital, as well as continue to run services of non-COVID patients, which are also equivalent there. And as Dr. Bhandari very rightly said, there are more people dying, more people getting affected with the non-COVID patients, I mean, non-COVID conditions than COVID. There are far more greater deaths and disease which is prevalent because of the non-COVID patient. It's just that the infodemic that has been created and the mass hysteria and the psychosis that is created, that nobody is talking about all the other non-COVID diseases. It is happening, and believe me, the hospitals are open. And of course, as I said, use technology, use telemedicine. If you are not comfortable getting out of your house, not comfortable going to the doctor, not comfortable going to the hospital, use telemedicine facility, contact your doctor, speak to them, let them see you, let them tell you whether you really need to come to the hospital or not. So it's available, it is possible, and it is doable. You have to step out and do it. And there are hospitals, and nobody is going to ask you to go away.
Thank you, sir. So there's
one question, Ayushi, I will like to address personally, and that is chloroquine and hydroxychloroquine.
Yes, sir.
It's asked by Neha. And this is a very important question, because you should know, particularly for a country like India, and I concede that this was a confusion created by our president. Now, India, here in US-like places, there was hoarding of things, and people took and started taking chloroquine. Mind you, I'm making a historical statement. There is no drug I know of which doesn't have side effects. It's a trade-off. We use the drugs to have a larger benefit, compromising with the side effect of it. And this is a drug which worked for chloroquine. It did wonders. But FDA and current studies have no evidence, scientific evidence of its working. Still, it is being used. And we doctors have used these drugs for insurance purposes. Whenever somebody is a desperate remedy and we don't have treatment, then we try treatment from here and there, looking at trade-offs. Like, say, for example, somebody is dying and he needs blood and you have a blood group, we are permitted to take a decision to transfuse blood of any group, ignoring that he may die of mismatched blood transfusion. Similarly, so my request to Indian diaspora is, please don't go and buy medicine and start taking it. Leave it to your doctors. If it is needed, they will advise you. ICMR has cleared the drug. Doesn't mean that you start eating the drug, because there are papers which said people have died of atrial fibrillation, and there are scientific studies which show. So chloroquine and hydrochloroquine, and for that matter, any other drug, India somehow or the other will have to regulate this self-medication. Rajiv Parekh would be consulted much later with a side effect, rather than better to go to a chemist and he'll buy the medicine. And this is why when we come from US, we buy medicines from there for people, because here you can't get even aspirin beyond a strength until there is a prescription. So please don't do self-medication. I don't see any reason. I don't see any. Rajiv may have his views about empirical treatment with chloroquine and hydrochloroquine.
Okay, thank you, sir. Yes, Rajiv sir, I think you have something to say.
Yeah, I was just saying, I said I would completely agree with what Dr. Bhandari is saying. Please do not self-medicate just because you've heard there are numerous drugs out. People talked about ritonavir when it came out. When Corona started, they said ritonavir is a drug. So
Right.
suddenly ritonavir disappeared from the market. Then they said chloroquine and hydroxychloroquine, it disappeared from the market. Then ivermectin, one of the anti-protozoals, it's basically a worm infestation drug, that disappeared from the market. Please do not self-medicate. Absolutely correct. Only do so under supervision of doctors, because as Dr. Bhandari very rightly said, all drugs, everything in life has a side effect. I always tell people, you cross a road and there is a danger, there is an effect, a possibility of being run over by a vehicle. So there is nothing in this world which is without an effect or a side effect. So take it only if you have been advised by your physician and whoever you are going to and consulting, but don't self-medicate yourself. As regards ICMR, the ICMR has laid down guidelines, but leave those guidelines to be followed by your doctor rather than you taking it off the website and following it yourself.
Okay, sir. Thank you, sir. So one last question from both of you is that people who have been infected, this is a question from Neha, that the people who have been infected with the disease, how are they being treated at the hospitals? Like what kind of a treatment is being given to them? What kind of a supportive care is being given to them?
For people who've been infected?
Yes, yes, sir.
Okay. So see, currently most of the advisory is that if it all depends on the symptoms that you have. If there are mild symptoms of, say, low-grade fever, maybe a little bit of a cough or a sore throat, then you do not need to get admitted into a hospital. You need to, consult a doctor, telemedicine consult, make sure that you are aware and the person is aware that you have been tested positive, and then you can be prescribed the regular medicine for either for fever or for a sore throat, whatever they like to give you, maybe an antibiotic, maybe something to reduce the temperature. So those medications are started off immediately, and then depending on what the progression of symptoms are, Whether you need to be admitted in the hospital, then of course the patients would go into the hospital. Then of course once you get admitted into the hospital, then the things to look out for are deterioration or breathing difficulties. That is the most important criteria which requires admission into a hospital. And then depending on whether a person is able to maintain his oxygen saturation in his blood, that is what governs the patient being transferred into an intensive care unit. So these are technical questions, these are medical questions and medical decisions which are best left with the specialists, the critical care physicians and the intensive care physicians, and of course the internal medicine doctors who are looking after this. But these are decisions. So the advice again would be crocin or paracetamol for fever, maybe an antibiotic if your doctor has advised you, and of course all the parameters, all the vitamin D, vitamin B12, zinc, vitamin C, any of these, I mean, or most of these should be taken. Drink plenty of water, stay isolated, do not come in contact with or try and keep meeting people and going out and doing whatever else, and just stay at home if you can, unless any deterioration occurs. I know of numerous cases who have self-treated themselves, self meaning stayed at home, treated themselves, and come out of it completely without any problems. And I think the most important thing here is communication, as Dr. Bhandari very rightly said. Communicate, communicate, and communicate. Communicate with your family, communicate with your doctor, communicate with your friends. Stay connected, because that is something that will give you a lot of strength, inner strength and physical strength, and of course be able to fight this infection.
Yes.
Could I make one last comment, Ayushi?
Yes, sir. Please.
The number of participants, as I see their profile, little bit of it, they are young and they have a lot of energy to do. And there is a lot of misinformation campaign, and there is a lot of no information to the people. You read social media, they give political color to it, they give reasons to it, they say this is all nonsense. I think one of the major job of Indian youth is to make people informed, those who don't understand. Because let me tell you very frankly, in an open forum, in the rural areas, people don't understand anything. They are doing it simply because there is a police pressure. And until it's something like seat belts, it is just you put a ribbon around to protect yourself from police without realizing that it is for your safety. The same thing, I think, if you educate even 4 people, your neighbor, driver, whoever it is, it would be a great service to the country. At least these persons would not go on disseminating their poor knowledge about the subject.
Right, sir. So I think it was a wonderful session with both of you, and I personally gained a lot of insights on how to stay motivated, what the practice is, how medicating, as Dr. Rajiv sir said, is going to be the future, and lifestyle changes is definitely something that has to be adopted. So thank you so much, Dr. Bhandari sir and Dr. Parakh sir, for your valuable time, and thank you to all the attendees for attending this session. Thank you so much.
Thank you. Thank you very much for inviting us to do so. Thank you so much. Hello, sir.
I said, have a safe trip back home.
Yes, sir.
No, I will have. Thank you very much. Thank you so much.
Thank you.
And it
Thank
was
you so
nice,
much.
and we'll connect.